Good morning, everyone. I'm Lynn Starr, and I'm a pediatrician who joined the Children First Board after years of working in clinical research. I joined this board because I wanted to devote my volunteer time to improving the lives of children and to do so based on sound research and thoughtful policy and advocacy. I am so pleased to be here in this room of individuals who are passionate about making the lives of children better. Today, we are going to share some sobering information about the state of the lives of children in our city as they struggle to overcome the combined impact of COVID, rising gun violence, and racial inequities. There are also, however, a few slivers of good news, and there can be even better news if we pursue the recommendations discussed in this report. It is our honor to have the visionary system leaders, Dr. Ayla Stanford, Dr. Tony Watlington, and Commissioner Kimberly, an amazing panel of parents, Sir-Jaz Carr Watson and Maurice Williams, and students, Mikayla Jones and Fati, Sidibe, to inform our conversation today. Thank you to them and to all of you for taking the time to learn with us and fight with us to push for the policies we know will make growing up in Philadelphia a better experience for every child. Donna Cooper, the Executive Director of Children First, will kick us off with a brief summary of what we found.
So I want to just say that we're very grateful to the system leaders and the parents who are here today. In many ways, the fate of our children are in their hands. Both the system leaders and the parents and all of you in this room, I know, are dedicated to the lives of children. And so we're learning together, we're building knowledge together, and hopefully we're taking action together. This year started in a little bit of a problematic way. Those of us who live in Philly know that on New Year's Day, we had gunshots on South Street, and a teenager lost his life just at the start of the year. And as of today, 1,100 people, a little bit more, have died from gun violence. And of those 1,100 people have been shot, 295 have died from gun violence, 132 children have been shot, and 21 kids have been killed. And so we have a serious challenge that predated COVID. And obviously the situation is being exacerbated by the response to COVID and our lives. In fact, gun violence remains the #1 cause of death for children over 15 in Philadelphia. And so we have much to do to make our children safe and to make them healthy. Today, the Annie Casey Foundation reported that 1 in 12 high school students in Pennsylvania have attempted or considered suicide seriously. So there's a lot that's on our minds as we start this conversation today. And so I just want to put that stuff in context because COVID was a calamity and it affected every one of our lives, but our children continue to face persistent structural challenges to their safety, to their physical well-being, and their mental well-being. So I'm going to very quickly run through the data that is in the report that's in your hand. I won't cover everything. I encourage you to read it. And I want to thank Dr. Stanford for pointing out an error in the report that we'll talk about in a few moments. Moving forward. Okay, let's see. There we go. So Dr. Lynn Starr pointed out that there's some good news. And I have to tell you, when we did this report, we do a series of reports every 2 years on the status of kids. When we did this report, we were dumbfounded to find that the share of children in Philadelphia living in poverty dropped during COVID. The share dropped. 16,000 fewer kids were living at the poverty level than pre-COVID in the first year of COVID. Now that was possible because the federal government put the child tax credit in place, but it does show that the federal government, and we'll see later, the state government and the city government rapidly moving to try and protect children. It also shows that we know how to get children out of poverty if we want to. In fact, the child tax credit combined with the availability of Medicaid, so on the far left is 26,000 additional children added to Medicaid in Philadelphia during COVID. That's a safety net, public health insurance program that kept our children able to see healthcare providers as much as we could get in healthcare providers during the crisis. 172,000 children in Philadelphia were able to rely on SNAP benefits. For those of you who don't know, that's food stamps, to meet their nutritional needs, in addition to the extraordinary effort by the city and school district to make sure children were fed. And 169,000 families got the child tax credit in Philadelphia. And as you saw, 16,000 children were lifted from poverty. And so the takeaway is that good public policy worked. It also got us rapidly a vaccine, so we don't want to in any way take away from the fact that there was an extraordinary health-related acceleration that saved millions of lives. But specifically with respect to children who are at much far less risk for COVID contagion and death, we saw these public policies really work. And the flexibility that the federal government permitted during COVID is something that we all need to seriously think about going forward. As I said, the system leaders really, look, they were facing the same challenges as all of us. They had staffing shortages. They had staff members who were sick with COVID, sadly died with COVID. They had family members of staff members who were sick, immunocompromised people. It was not easy for the system leaders to do what they did. And we all know there were stumbles in Philadelphia, on the city side, the state side, and the school district side. But let us not forget that they did some pretty remarkable, rapid policy development to meet the needs of children. 7.7 meals delivered, most of that city and school district, getting that out to families, 70 access centers set up, nearly 83,000 laptops distributed, and thousands of teachers trained, 19,000 hotspots. We could have done better, but let me just say we showed extraordinary will, and that's the kind of will we need to continue to have so that our children's lives get better. Now, 5,100 adults perished in Philadelphia during COVID. And as Dr. Stanford points out, so did at least one child, perhaps more. Alana Trunch, a 17-year-old Albany High School student, died from COVID. Now, the state statistics don't have her listed as a child death, but we know in Philadelphia, thanks to Dr. Stanford, that her name needs to be remembered. So we also know from this data, much like the rest of the country, that Black families suffered the impact of COVID much worse. And I know we all owe Dr. Stanford a debt of gratitude, not only for bringing this to our attention, but for tackling it head on when our systems were too slow to respond. But these children are suffering. They are mourning grandparents, aunts, uncles, cousins, teachers, community leaders, rec leaders, people they know who died. And so just as we as adults are in mourning, children are seriously in mourning around us. I said that the Casey Foundation found 1 in 12 high school students seriously considered suicide last year. In Philadelphia, the state has something called the Safe to Say helpline. Very few kids even know about it. But in fact, the number of kids who called that helpline saying they felt like they wanted to take their own life during last year, so from 2018 to 2020, so for the last 2 years during COVID, they wanted to at 3.5 times the rate that spike compared to the state. So all the calls across the state rose about suicide, about bullying, about anxiety, about depression. This trend follows the national trend. Our kids are not doing well. The anxiety that they feel is real, so real, they're willing to take their lives. Now, one of the good things, another piece of good news, is that Philly families are vaccinating their kids at a faster rate than other parents across the state. We won't comment about the rest of the people across the state and why that's happening. But in fact, it still shows that 54% of adults and kids, of kids in the city who could be vaccinated are not. And so as school reopens in September, as there's a new variant coming around, we need to redouble our efforts to solve this problem and let the red counties worry about themselves, but Philly definitely needs to pick up the pace. In fact, there's 400,000 adults and children in the city estimated to still need to be vaccinated. And again, you can see that this is most pronounced in actually Black and white families, but significantly in Black families. And so we have a lot of work to do in our public health infrastructure to really protect the health of the families and the children in the city from further risk of death or long COVID or other ancillary illnesses that happen as a result of COVID. The anti-vax sentiment is also taking a toll on the adherence to school vaccines. And so we have to also be very concerned about traditional immunizations and the number of families that are seeking exemptions from them. But once kids are getting their immunization, they're either going to childcare or school. And in so many ways, our childcare infrastructure is our school readiness infrastructure. It's the parents' partner to help them make sure their kids are ready for kindergarten. And we have 12,000 fewer kids in childcare today. And it's not that we think that parents aren't trying to send them. What we know is that our childcare centers are closing, our childcare classrooms are closing, and we have waiting lists. Because childcare staff are exiting the childcare infrastructure in droves, they can earn more working for Wawa or Target than they can helping build little minds. In fact, 19% more. And what you can see in this chart is we've always earned more in retail than childcare. Sorry, state things in America. But the green line on the bottom is childcare, and you see the gap between childcare and retail getting bigger and bigger. And now retail is offering benefits, which is great. Childcare providers still often struggle to do that. So the likelihood we're going to rebuild our childcare infrastructure without some serious rethinking of policy is magical thinking. This is a real problem that we are facing in Philadelphia. It affects, I would say, parents' ability to go to work, obviously. We also know that Philly had a very extensive school closure. Many of our students didn't go back to school until January 2020. Schools were closed for much of March to June of 2019. And one of the things that I want to bring to your attention is before the schools closed, our kids were not doing well compared to their peers across the region. So on the far left of the screen, you see Radnor and Lower Merion, and that's the share of their children who were able to read at grade level. And the bottom over here on the far right is Philly and Reading. Now, not only were their children in Philly and Reading further behind, but Philly and Reading has significantly high poverty rates than their suburban peers. So they have a compounding impact when they're learning. And what the school district found is that second graders to fifth graders seem to have lost ground since COVID took hold. So the school district's own assessments are showing early warning signs that these critical learning years, because if you don't learn to read, by the time you enter fourth grade, you're probably not going to learn to read afterwards. And so we have a group of children beginning to get promoted through our system that we know were already behind before COVID and then fell further behind. Now, the PSSA results, the state assessment results will not be up until September. We'll know more about this data then, but this is troubling and it's a warning sign that we really need to double down. Now, how do we double down when Philadelphia has such limited resources? Here you see again on the far left, Lower Merion at about $18,000 per student to spend to educate their students. And what you have in Philadelphia is under $10,000 to educate their students. Further behind, deeper in poverty, in families more likely to have been disrupted or harmed by COVID, living in a city with gun violence, trauma, mental anguish, and fewer resources to solve the problem. So that's the state of what we see as the challenges our children face. And these are adult challenges that we need to solve. So we have 5 recommendations. The first is, I want to be really clear that the city and the school district really, they did extraordinary work. We called them a lot, we complained to them a lot, but I have to say they really did a lot of work. And we think it's critical that they take the Office of Children and Families and they document what they did so we don't have to reinvent the wheel and the lessons learned. Our memories will fade, the people involved will leave, we need that expertise, and we need to start planning it now for the next emergency. Whether it's a recession, a public health emergency, a climate crisis, it's coming, and we should be ready, and we need to make sure our children are taken care of, and we need to make sure that the equity issues that we saw all during this crisis don't get repeated. We need to invest in our kids so they can catch up, right, and get ahead. Right, catch up should not be good enough. Now, the city and the school district received substantial funds this year from the state, and they also have American Rescue Act funds. And so our big questions need to be, how do we remedy the falling behind of students? It's critical that we do that. And at the same time, we can't take the pedal our foot off the pedal of getting the state to invest in our schools, because that disparity, Philly is the lowest spending school district in the 5-county region in which we live. A completely unacceptable reality. We need to think about behavioral health services. We are very lucky in Philadelphia to have Community Behavioral Health, a nonprofit insurer that manages the behavioral health needs of children on Medicaid. So lucky. But we still do not have a system in Philadelphia that really meets the needs of children from 0 to 18, for all levels of behavioral health needs, and in culturally competent ways and ways that are responsive of race. We still have to build that system. Our kids need us to do that now. You saw the data. This is a very alarming situation. We need to think about childcare and solving the childcare crisis immediately. Families who couldn't afford childcare last year are going to have a harder time affording childcare this year because of inflation. So more children are going to be missing out on the developmentally important years that education that childcare provides, and we need the state and the federal government to really make sure that the resources are released for that. An historic bill in Washington that passed the Senate over the weekend does not have a penny to solve this problem, and that's the problem that's affecting the early and the most important developmental years of our children. And last, we need to protect children from poverty. Poverty is a life-stunting experience for children. It affects their ability to learn. We know how to solve poverty. We showed we could do it in one of the darkest years of America's history during the pandemic. And so we need to reenact the child tax credit, and we need to make sure that the flexibility that kept the safety net in place for poor kids remains. These are our ideas. We have invited parents and students and system leaders to share their ideas as well. Today's conversation is about what do we do next. Obviously, we want to correct the record. If we missed anything, we want to make sure you know a little bit more context. But really, this is a call to action. And we started the call to action on your seat. You see postcards to the U.S. Senate. I encourage you to sign them. We're going to start a panel in a second, and as our panelists come up, which are Sir-Jaz and Mr. Williams and Fati, and I don't know if Mikayla is here. Mikayla's here. Oh, good. Come on up and take these seats right beside my computer. And while you do that, I just want to thank John Chapfedler in the back, who collected the data for this report for Children First, ML Warnicki, who assisted in thinking about how we structure this report, Stephen Fines, who through all the versions of this report made sure it looks great, Inella Ray, who helped us reach out and learn from parents throughout the process of putting this together, and Amy Covetta, our press person, and for her tremendous work in making sure this report really meets our needs here collectively in Philadelphia. We had invited Sherry Gregg to be our moderator for today's event. I hope you listen to WHYY. She is the on-air host during drive time. She was at a journalist convention over the weekend where she was given an award, so hooray for Sherry, but she also was exposed to COVID, having dinner last night with a friend who had COVID and felt, obviously, to keep us all safe, she wouldn't be here. So I'm going to join the panel over here and serve as our host. Okay, so let's see. Thank you. So we will have time for questions, but we're going to walk through this and keep this moving, and I'm going to do the best I can to make sure everybody's getting as much information as you possibly can. So the first thing I want to do is start with the parents who are here. And I just want to ask you, Sir-Jaz Carr Watson, tell us a little bit about what brings you here today, and your experience and what you think we need to be doing better for kids. And hit your mic right there. Bring yourself on.
Good morning, everybody.
Good morning.
What brings me here today is knowing that we want to come to the table for a solution. I think it's been I think it's amazing how transparent everything has been across the board. I work in the school district now for 3 years. Excuse me, I worked within public schools for 3 years. I was with the school district of Philadelphia, and now I'm a kid Cooper across academy schools. And so, in being in the schools and seeing how everything, if we can say imploded, just because we didn't have a handle on everything. And that's not to say that it was wrong. It's just to say that we did not know to expect the unexpected, right? And we hear about things and we watch movies like The Day After Tomorrow and Independence Day. We do. And we say like, oh, I'm gonna be ready. You know, I'm gonna stack my basement with bottled water. But then the day comes and we're not prepared. And what hit most heavy was, you know, I work with kids every day, day in and day out, and seeing them pre and seeing them post, it's almost two totally different kids, right? And even within my son, you know, he's 13 years old, and watching this past couple of years of knowing how he learned and knowing what's best for him and knowing, you know, even as a father, teaching is not my trade. His mom is a teacher, and it was even hard for her to say, like, what do I do in this moment, right? I can't help my students. How can I let them help my son? And so I think what brings me here is the energy of knowing that we want to talk out solutions. It does not mean we will all agree. It does not mean we won't be flustered with emotion, but it does mean that a conversation is being had that I don't think has ever really been had, and I'm excited to see it happen.
Can I ask you one more question before we go to Mr. Williams? Did you feel during COVID that people were working to help you and help your kids? Like, did you feel like the government had your back? Did you feel like community leaders that needed to help you had your back?
I did feel our community leaders were helping, and they were pushing the narrative to try to exhaust. I think that them trying to push the narrative to exhaust everything that they could, it just had an impact on my community to say, you know, I'm a black man in West Philadelphia, right? And so to see churches come together, to see different religions, you know, to see a mosque and a church come together to try to get teachers from whatever you believe in, whether you're LGBT or whether you're a Christian or whether you're atheist, to see these programs trying to be developed at the best that they could. That was an amazing experience. I don't think in living in Philly, I've really experienced, like, it wasn't a panic, if that makes sense, right? It was like, hey, this is what our kids need because they're on our shoulders at the end of the day. And we need to do something. We can't just sit back. And the initiatives from the government and the federal government, everything was needed. Everything was boosted. So far, I was happy with those results.
Thank you very much. It's really interesting to hear that. Mr. Williams, Maurice Williams, tell us a little bit about what brings you here today, you know, sort of like Sir-Jaz, a little bit about what you see about your kids. I'd love to hear that.
Sure. Well, good morning, everybody. Thank you. I'm excited first. My wife is in the back, and gotta give a shout out to her. I'm also excited to see all of you here because typically when I come to events or forums like this, it's a small crowd. You know, so I'm happy to see the numbers that we have here today. What brings me here specifically is I am a parent. My daughter is 8 years old, and I care about the well-being of her as well as her educational advancement. Beyond that, I have a nonprofit organization called Born with Purpose that really goes into building the character development and leadership of young people beginning in 3rd grade. And I think I'm here mostly because I'm hurt. I think that when COVID happened, when the pandemic happened, I specifically was looking for this radical, innovative, like new system, new structure of how to pour into and invest into our kids. And yes, things did happen, but I feel like they were Band-Aids, and it wasn't a system overall to really impact the lives of our youth. And I'm here because I feel like this is an opportunity for change, like true systemic change for our Philadelphia school district. So I'm here for the opportunity, I'm here for the optimism, because I realize, and we realize, that we can't go any more like this. It has to change. And I believe from the support that you mentioned in your data review, that if we stay true to those things, that we can start to see some of the change that we all deeply desire.
Thank you. Thank you. So I wonder, you work with kids in your community throughout COVID, and I just wonder, thinking about the status of those kids now, what do you see in terms of how they're feeling, how they're doing, how they're engaging? Do you still see lingering effects?
I do. From the social responsibility aspect, I feel like kids are losing the sense of connection, of how to speak to each other and to respect one another. I feel that there, but then also I feel the focus of our students as far as how to succeed and excel is a little bit off, in the sense that there's not a priority or a focus on education. Because as a district, my personal opinion is that we have not connected to the youth in a way for them to see education as fun, and this is what I need, and this is what's going to push me to my next level of self. So the long story short, I do feel like with our schoolhouses, before we can give them curriculum, we have to make a connection. And our teachers, our school leaders, need to really focus on the relationship management piece in order to get the goals that we're all searching for.
So well said. Thank you so much. I'm going to ask our students to comment on that. I'm going to start with Mikayla. Now, Mikayla and Fati, they have had the opportunity to be part of work with us where we have pushed lawmakers to fund our schools, gone to Harrisburg, spoken at rallies. So these are young folks who certainly share your views, Mr. Williams, that there's so much more we can do. But I wanted to ask you about your thoughts, start with you, Mikayla, about sort of how do you think kids are doing now, post-COVID, almost post-COVID, and what do you think we need to be doing? I'm going to hit your button, right? Go for it.
Hello, everyone. Good morning. I'm good going to student at the high school. I'm going into my senior year. I feel that COVID has an effect on every last one of the students in the school district. Me specifically, in my peers around me, I feel like we learned in a different way throughout COVID, and once we came back to school, we were expected to adapt so quickly and so rapidly. And it was not really much compassion to the way that we spent almost 2 years in COVID, with a teacher not in front of us, using the computers and things like that. A lot of me myself, I learned a lot of things on my own because my teacher not being able to give me the education that I'm supposed to have throughout on the computer. And once I came back to school, I didn't really have any adult or even friends to like guide me through what high school is supposed to be and allow me to learn the way I'm supposed to learn or socially adapt and connect with others when I'm supposed to. I feel like I had this fairy tale dream of what high school was supposed to be, and due to COVID, I didn't really get that. Like, I left high school my freshman year with a group full of friends, and I came back to Watlington. And prior to COVID, I was going through a lot, and I struggled a little bit in school. And then COVID happened, and I wasn't learning anything at all. And then I came back last year was my junior year, and that was the most important year for me. So I had to play a lot of catch up, and I had to maintain a working up throughout the whole year so I can get into that college I wanted to. But there was not a lot of guidance to do that. I feel that every student needs someone to guide them, to be there to talk about that hard test, talk that project that's coming up, or just a struggle that they're going through. And due to me not having like a whole bunch of friends, I wasn't able to be with friends, so I was seeking like an adult to be there for me. There wasn't much of that.
Thanks for keeping us real. I want to turn this over to Fati, the mic right there. What was it like for you during COVID? How do you feel like kids are doing right now?
Good morning, guys.
Good morning.
I'm Fati. I'm going into 11th grade at Bodine High School. So I would just say COVID started my 8th grade year, like around half, towards the end. I felt like a freshman in my sophomore year, which was last year. So I feel like the little things that go into the bigger picture, they're really focusing on how to get students past COVID and how to get inside of the school, but I feel like they're not focusing on helping students maintain the workload and helping students with their mental health, and we're really struggling. Like, I'm not gonna sugarcoat it. I feel like we're all figuring out how to just be a student inside of school. We're all freshmen, we're all getting to know high school. And I'm a junior getting to know high school. This is my most important year. And I feel like the teachers definitely don't have a connection with the students because they're strangers to us as well. Like, we've known them virtually, and we've had to struggle virtually because students are checked out, we're not inside of school, we're not focusing. I'm a kinesthetic learner, and I know a lot of my friends are kinesthetic learners, and a lot of students are kinesthetic learners. So we're gonna tend to check out, and we just need to pair apart and get 50-50 as students and teachers, and focus on the little things to move forward to success.
So I would love to continue to talk with this panel for the next 2 hours. I think we all would. But what we're trying to do is make sure we have a full perspective on how it feels and what we need to do together. You gave us incredible recommendations about focusing on the small things, giving people support to do the hard work and make these transitions, to really think about how we do collective action and do things in a more ambitious way than we did before. So I want to thank you and invite you to stay here. Just go back to your seats. We're going to ask you questions perhaps towards the end, but I want to bring up the next panel because we have a commitment to enable them to get back to their system level work. So thank you very much. And Dr. Stanford and Commissioner Ali to come on up, and you guys can sit on that side and take your life easy. Thank you so much. So there's several perspectives on what happened to kids during COVID, right? The kids themselves, the parents, and then the leaders who were attempting to really make their lives better. And it would be hard to start this panel without thanking Dr. Stanford, who, as we all know, is a national hero, not just a Philadelphia hero. Of white Philadelphians, of Hispanic Philadelphians, of Asian Philadelphians, just stepping in and recognizing there was a much better way to get things done. And so some of you may know that Dr. Stanford is now the Regional Director of the Department of Health and Human Services. This president recognizes excellence and brought her in, so I want to thank her. Also up here is the new superintendent, Dr. Tony Watlington, and this will be probably one of our first times to get to talk with him in public to really hear. He's been doing 100 listening sessions, so he's been listening a lot, so this will be a chance to really get his views on what we think we should do. And then hero of the city, Commissioner Ali, and the commissioner has been working with children in the foster care system and the juvenile justice system for more than 20 years. And some of you have seen that the Inquirer did a pretty troubling expose over the last 2 days about the state of our foster care system. And there's no debate from Commissioner Ali that we all need to do better. We're going to focus on this report and not that for the balance of this event. And I just want to start with Dr. Stanford, and I just want to ask you, you've made a pretty big transition from being a pediatric surgeon to taking action for COVID to now being in the federal government. And I want to know, what do you think from your experience we need to do to get this right next time? And can you hit your question? You can bring it close.
Can everyone hear me okay? I agree with Mr. Williams. It is nice to see all of you here talking about the fate of our children. for me, it's kind of, where else would I be? You know, I'm a product of the Philadelphia public school system. I was born and raised here. To hear the students talk about how challenging it was for them, I'll tell you that that grit and that perseverance that you had from 8th to 11th grade to get you through, that skill set will carry you in your life. And of course, when I was your age, things were different. It wasn't a pandemic, but it was still tough. You know, for those of us who grew up, you know, and underserved and were on needed Medicaid benefits in the health clinics to get through, to get to college and so forth, it was tough. But those skills, I promise you, that I learned as a child is what gave me the tenacity to step out during COVID. And because I love the city so much. So how you go from a pediatric surgeon to saving people, I mean, obviously we all go into medicine, I think, because you want to help people. I have an affinity to children and their betterment. They are our future. What we do now to prepare for the next are all the areas that were impacted. Childcare, healthcare, and that includes mental health, food banks, the digital divide, and creating a stockpile of all the supplies that we needed the most of and we didn't have. And then you take the zip codes, our north, south, east, west of our city, and you identify a faith-based entity in that area and a hospital in that area. We are so fortunate to have so many. And you list where all those resources can be found in an emergent situation. So there's not this scramble. There was a crazy scramble in March of 2020, in April of 2020. And the only place you could get a COVID test was 19107, which is Center City, where it was most affluent. But in 19132, where people were most impacted, there was nothing. And so simply what I did was I went to every zip code where the COVID rates were the highest with all of my PPE from my surgical practice, and I tested people barrier-free. There weren't all these check boxes you had to have to get a test, and there was no cost incurred. And so often we ask for money now to the federal government part of it. Much of what you need, and I think what I demonstrated, it's not more funds, it helps. But it's really the coordination, for example, of federal government and city government and superintendent and nonprofit, all and we have to hold one another accountable. So when the American Rescue Plan gives however many $1 billion to the school district of Philadelphia, we need to see how was that used for mental wellness and health. Same with the city. How was that used? How are you measuring those outcomes? And we may not know exactly. It may just be that you see fewer children needing emergency medicine, emergency visits for anxiety and such. So it's a process, but I think what we learned, honestly, what the students taught us especially, is what they needed. They needed food, they needed computers. The parents needed a place to take their kids. They needed health care. You needed after hours. We did a lot of our stuff from 5 to 8 because folks were working. You know, our parents couldn't shelter in place and work at home. And so we learned so much from that. And I think what we do now is you have all those resources centrally located. Some people need flyers. Some people need a website. Some people need it posted in their bodega. Wherever, you have to communicate differently for our communities. And we know which ones will suffer, and that's where you have more resources allocated. So we learned a lot. It wasn't the best, but we have to look forward. And there were some things we got right. And again, the biggest lesson for the children, I'll say, to come through on the other side as a senior, as a junior, you acquired skills that you don't even know you had that are going to propel you stronger and further than many. So thank you.
Thank you, Dr. Thank you very much. You can see why you were able to just take action. Thanks so much. Dr. Watlington, you're new to town, and your school district didn't escape COVID, where you came from, but this one's obviously was closed perhaps longer than yours. And this school district obviously has a community where we suffered extraordinary death and sickness from COVID. So I just wondered, from what you've heard since you've gotten in town, what you're thinking from your own experience as being an educator for so long, what does it tell you about what you think is imperative for the district and your partners to do?
Certainly, I want to echo what Dr. Stanford said about the importance of coordinated services. That's certainly one of the lessons I've learned in North Carolina and have come to learn here in the school district of Philadelphia. There's an awful lot of work that the 19,000 heroes and heroines of this school district did in March of 2020 to include making sure that kids got fed, getting food out to people. You reviewed this in one of the slides. They worked very hard, as I understand it, to try to get some hard materials out to families shortly after schools closed. And then what a gargantuan effort it was, with the support of this community, to get Chromebooks out to every individual. I think that's really, really, really significant. Not to mention getting kids tested, finding ways to reduce barriers and things of that nature. And I think it has implications for how we hear our children's voices. How did they experience and continue to experience the impacts of the pandemic? It was so insightful to hear two students speak earlier. And as I've gone around and participated in listening and learning events around the city, I've had children, particularly adolescents, to tell me that it's fundamentally changed how they interact with their peers. Some have just kind of pulled back and don't feel comfortable interacting. I've had a number of sessions where our children have talked about the impact of depression, anxiety, and every time I hear about, in my last district, every time I've learned of a child suicide, whether it's in North Carolina or here in the school district of Philadelphia, it has a way of making you just stop and reflect. And you just can't go on with the day as normal. So I think we've done a lot of work, good work here in the district. We certainly celebrate the people who work really hard to meet the needs of children. But to Dr. Stanford's point, I think it just underscores for us, A, we have to pay attention to equity issues that this pandemic highlighted that were already here and that have been exacerbated. And B, those 19,000 school district employees, teachers, principals, et cetera, can't do this work alone. It just underscores the importance of this kind of partnership and community effort.
Thank you for raising that. One of your key partners in this was the city. And, Commissioner Ali, you were in a kind of a hot seat during this, working with children in the foster care system. And those are children who suffer awful lots of mental health issues, as do their parents and their caregivers. So I just wondered, looking back, what do you think for the next time you might do that would make it better for those kids? Like, what's your takeaway?
Yeah, so first let me first state, I want to give just a little background about the Office of Children and Families. And so the creation of the Office of Children and Families actually occurred in January of 2020. That was extremely timely. And the reason why it was extremely timely is because it was right before the pandemic. And so the office was created to bring together departments so that we can also be a convener to make sure that services were integrated. Services, resources, policies was integrated. And so we had to hit the ground running. And so under the Office of Children and Families, you have the Department of Human Services, who has both the child welfare as well as the juvenile justice services. You have Parks and Recreation. You have the Free Library of Philadelphia. You have community schools. You have PHL pre-K. And so the highlights that you indicated, Donna, in both the booklet, but also in your PowerPoint, we were at the table in order to try to integrate the services because we already knew what children, youth, and families need. And so despite the fact that we had COVID, the child welfare system did see some gains throughout in that we were able to continue to service young people in their own home. Over 2,000 young people stayed in their own homes and communities. However, the pandemic kept them isolated. And so what you see the aftermath of the pandemic. And when you talk about the behavioral health and the mental health needs of young people,
they are struggling. So when I look at the foster care system, we need each and every one of you in this room because they may not have the level of tenacity and resilience because they also have the trauma impact in that they were abused or neglected by someone who cared for them. And so how I view the child welfare system is that it's a community-based approach. You know, to child welfare, we were not able, for example, to do the level of foster care recruitment as we typically do because we were trying to manage a workforce to ensure that young people were safe. And so what you see, even the culmination, I know we're not going to talk about the article, what you see is that's what you see. You see young people who were struggling before COVID and during COVID. And I appreciate this call to action because I need all of you.
Well, you know, feel free if you want to talk about it. I'd love to focus on the report, but I think your point is that, and I think the article's pointed out, that the normal course of action to recruit families who would be willing to offer a safe, loving home for children in crisis really had to take a back seat, it seems like. So maybe that's a lesson learned, right? Exactly. So, Dr. Watlington, I want to ask you a question. You know, Mikayla and Fati talked about coming back to school, and remote learning doesn't sound like it was an extraordinary experience for them, to put it mildly. But I'm just wondering, and this is sort of at a very small level, but it does speak to maybe Mr. Wallace's point about doing things radically different. Now that we have a teaching core that is able to use technology, now that we have students who have technology available to them, how do you see that affecting how we educate?
Thank you. Notwithstanding all of the bad stuff about the COVID-19 pandemic, I do think it's important for us to realize that we have this once-in-a-lifetime opportunity to totally transform how we use technology as a learning tool. Now, when the pandemic hit us, teachers were across the spectrum at any number of places on the spectrum, from not being comfortable with the use of technology, like young people typically tend to be good at, all the way to people who were early adopters and were very quite proficient at using that technology. So at a moment's notice, the world changed. Now, my district in North Carolina was the first school district in the state many years ago to transition to a one-to-one device initiative and put Apple products in the hands of every student many years ago. A couple of things we learned. A, technology is here to stay. B, we've only began to touch the tip of that iceberg in terms of how technology can help improve or enhance teaching and learning. C, Google, Chromebooks, laptop devices, etc., were never designed to replace teachers. So it's really, really important that we not use technology as a way to somehow limit budgets and say, let's put more kids going virtually. It has to be a tool that aids good, high quality, highly supported teachers. I think that's really important. I'll also note that it's important for the tools not to become a glorified worksheet. So it has implications also for how we arrange or set up teacher preparation programs at our colleges and universities. So that teachers really feel comfortable with two areas. One, how do we use these technologies in our classrooms to understand and deliver the content standards that we teach? Number two, how do we use the technology to really authentically engage students and improve our pedagogy so that kids experience schools in a way that's more akin to how they learn in their strong technology use. So I think those are two things that I would point out, but I think it's an exciting opportunity for us.
Well, another good lesson learned perhaps from COVID, right, that we can do better as it relates to how we use the platforms kids are used to in a way to educate them. So I want to ask Dr. Ali and Commissioner Ali and Dr. Stanford a question about the mental health of our kids, right? And I'll start with Dr. Stanford. You were extraordinary in pointing out the physical health disparities during COVID, and we know that there are behavioral health disparities as well. And so in general, when you think about equity as it relates to health and well-being, and specifically given the messages that we've heard today about children's mental health. What are your recommendations for how we tackle this in a way that is head-on in closing the equity gap in the services?
So that's a big question. But as I sit here, excuse me, at 440 North Broad, the schools are a safe haven for our kids. It's where they get shelter. It's where they get food. For our LGBTQ kids, it's a place where they can be themselves. So often in their homes, they can't be that person. But in school, they have that gender affirming identity that it's okay, right? So when we took away, and I'm saying we, and this is a good point to say, everybody's mad at somebody because of COVID, but let's just remember that was nobody's fault, right? And we're angry about it, but that pandemic affected all of us. We had no control over it, and we all did the best we could with what we had. But still, during that time, it took away the protection that the school afforded. So in my mind, we keep the schools open. Right now, how do we keep the schools open with communicable diseases? We make sure as many kids are vaccinated that can be vaccinated. Before I took this job, I led a FEMA mission in January of this year. We went to all the public schools and vaccinated the children because we went to them. That's what you do in a public health emergency. You go to the people, right? The kids needed us to come to them. For mental wellness and health provided in the schools, the parents are working. They're not getting off work till 5 or 6 o'clock, and every place is closed. Every place is closed. I know that because I was that kid. That's why we used the ER so much, because that's the only place that was open. And then you get the stigma of, oh, here's that Black and Latino and that poor white kid using the ER, abusing the system. No, my mom was at work. My dad was at work.
Sure.
So the schools are the places. And I would charge you, Dr. Watlington, that the school district has used the same contractors forever. The same hospitals, the same, nonprofits, the same whatever. There are a lot of folks out there that did the work without the money to give the kids what they needed until they waited for those resources to come. And I would say find those places because those folks are committed and did it without the funding. Right? The other thing is we have to train more, and there's been a lot from the Biden-Harris administration and Secretary Becerra on this, to train more mental health and wellness providers. And I know you're thinking, okay, you need your bachelor's, you need your associates, you need your master's, but there's a lot of folks in churches, in synagogues, and mosques that would be phenomenal with the appropriate training and a background check, right? Because it takes time for you to go to finish high school and go to college and get this and get your on-the-job training, where we have all these folks that work for the city and work for the state for 30 years that are retired and just sitting around watching the news and talking about it, that could be integral in our schools. So yes, we increase the pipeline and we get more kids of color and more trainees that reflect the populations they serve. But in the meantime, there's a whole resource of untapped people. So we keep the schools open. We train more non-traditional folks, as it said, in addition to getting more of our students of color, because they get it. They get the cultural humility that is necessary to take care of our children. And then lastly, I'll say about the violence. And it doesn't happen in the schools. That's one thing I want to mention. So many people are like, our schools are violent. It happens in the neighborhood and the perimeter of the school, but it doesn't often happen in the school, right? And you hear, unfortunately, of kids getting shot and stabbed, but it's not happening in the walls of the school. That being said, they need our support. We vaccinated today, a child was murdered down the street. And the next day we were there vaccinating, and I thought, we're doctors, we're nurses, we need to be counseling these children. We need to be counseling the teachers who were in tears and everybody was in school like a regular day, like we've gotten so used to the violence that it just, you pick up. The person who shot the kid went to the school and the person who died went to the school. So everyone was impacted. And I think, and one of the things I learned is that having that, as you said, culturally competent, I call it cultural humility, because it helps when it's a Black face or a Latinx face. But if you just are empathetic and care, and you could be white, you could be Indian, it doesn't matter, but people know when you care and when you feel about them. So having those people immediately deploy. Immediately, and I don't mean a union leader, I don't mean assessing the situation for risk and safety and all of that. I'm talking about real people pulling those kids into a group, pulling the staff members into a group, having the hospitals on call to show up and give those kids the support and the teachers the support. And I'm so sorry, I'm talking so long. But you asked me a big question. And so again, it goes back to keeping the schools open. It's a safe haven for our babies. And then making people come to you. You give them so much money to give your physicals and do the vaccinations and whatever else. Demand more. Tell them you want their mental health crisis workers. You want someone on call. Include that in the budget while we're training more people. And I, you know, the school is a place. I mean, honestly, I can say it saved me having a place to come, knowing I had a meal, knowing I had a teacher who might encourage me, or a friend, or a track team, or a sports team. Our schools are so important, and so I think we support you if you accept our help. Absolutely. And use the community more. I think they felt a little shut out. Yep. And use the organizations, again, that stepped up, not your typical ones. I gotta say that the contracts go to every single year, producing results or not, and step out of that comfort zone. And that's what I would say. And I have to mention 988, that Secretary Becerra with the suicide hotline. The ease of dialing 988 like 911 for a crisis has been life-changing. The numbers have gone up, and we have been able to get more resources out to people, sending out mobile crisis units like the consortium in West Philadelphia does, to get folks. And we know that if you can get to someone within those first 3 minutes, that you can stop a suicide, right? And then you have an opportunity to work on behavioral therapy and cognitive therapy and all of that. But we can do this. I don't want anyone to leave being despondent. I appreciate you bringing us together, giving us something tangible to work off of. But again, my take home is that we work in concert, that you tell your teacher what you expect. You said 50-50, you present your expectations. Absolutely. This is what I would like. What would you like from me? And you check in every now and again, right? Because they didn't know you at the beginning, you were virtual. I want you to get to know me. This is how I learn. How can I help you teach? Let me tell you about my classes, right? Make yourself an integral part of your learning experience. We're getting paid to teach you, okay? So make them honor what they're doing. And I appreciate the teachers. It's been hard. It's been hard for everybody, but we are a resilient city, right? And we will come through, right? Preach. All right, I'm sorry. It's good. It's hard not to talk about.
And I want to say, not only do the crisis response teams play a critical role, as you talked about, in de-escalating immediately and saving lives, but the data on helping kids who witness that immediately as well, and the importance of immediate support for children when they have been a witness to trauma is a critical change that we need to make in expectations, right? So Commissioner Ali, I know it's a hard act to follow, but I know you can do it. So what are your thoughts?
Yeah. So I want to thank you for that, Dr. Stanford. The focus on the schools are definitely key when you talk about safe havens. I can roll out any prevention program, but the intrusiveness nature of the Department of Human Services, we can't do it alone because we're not trusted in communities. And so I need to pour into institutions that are trusted, which are the schools, which are the community-based organizations that for some reason, because they can't dot the I's and cross all the T's, can get a contract with the department. And so that's our focus. I will say that I wish that our colleagues at CBH and DBH were part of this conversation because I know that they can also add a richness to this. But I will say that the number of programs that both CBH as well as DBH has at the schools and the communities that the Department of Human Services partners with them. My dollars are restricted in that I cannot pay for therapeutic services, behavioral health services or mental health services or educational services, but I can pay for a social worker. I can pay for a case manager. And so what you see is the blending of funding when we put it in the school district, in the schools for young people. I will say it's not enough given the needs of our young people, but we are strategic in identifying the schools that need it the most. And so my takeaway is using those organizations that families feel most trusted and making sure that I'm able to fund with the conjunction of the Department of Behavioral Health and CPH in order to meet the needs of young people.
Thank you. So I want to point out that the Kennedy administration, when they were running for office, we had a couple big expectations for the mayor. One of them was social workers in the schools. And I want to point out that Karen Lynch is here, who's the head of student supports. And Karen and the city worked together to really build a social work core. Are you close to 300 now? A little bit less shy of that, 250, 300 social workers in the schools, thanks to the resources of the city and the partnership with the school district. And in addition, every school now has a partnership on at least intensive behavioral health services. Yeah. So that's a kid who is pretty in crisis, right? So we have partnerships for kids who are in crisis. And we have some light touch services, but as we heard from Fati and Mikayla, we probably need to, and a call to action from Dr. Stanford, we need to think about that whole continuum. So there's a lot of work to be done, but I do want to be sure people know that this administration, the Kennedy administration, really did lean in many ways to the schools and the behavioral health services, and we have a long way to go. So with that, I want to ask folks, first of all, I would like to ask if any of the press have any questions for any of the youth, the parents, or the panelists before we take any questions from the folks who are here. You guys good? Okay.
Donna?
Oh, sorry. Yeah.
I have a question for either Fati or Mikayla.
Come on up, you guys. Join us up here. Thank you.
So when I first returned to school, I feel like when I first returned to school, my school specifically was so into getting back to norms, making it to school on time, going to classes and stuff like that. They didn't really reflect on the mental health aspect of our needs for that. So it wasn't like pretty obvious where we should go. We all know we have counselors, but the ratio of students and counselors is crazy. Like we have 4 counselors in our school, and we're not clear on which one belongs to us. Basically, it's assigned by last name, but we're not sure of that. We're not sure of their names, but there's 2,000 students and 4 counselors, 2,000 plus students. So it wasn't really clear who we should go to if the counselors were not available. There was a lot of times where counselors were just not available. And I remember it was at the end of the school year. The first time I met a counselor, my counselor, I walked into her office and I just like cried. She didn't even know my name. I just started crying, but I never had the opportunity to get to know her. Like I was never introduced to her. No one ever said, okay, this is your counselor. If you need help, then go to her. I just took it upon myself to find someone because I needed someone at that moment.
So the funny thing about my school, Bodine, is we just had to decrease 2 of our counselors. We only had 3 counselors in a school of about 500 something students, and I kept stressing that we need we need more counselors, we need them to be aware of our problems. When you go to the counselors, they expect you to talk about what you want to do for school. Even when I try to go to the counselors, it's like, oh, I'm a little busy, can I take your time off, or can you come during this time, which is really hard. It was mainly focused on school. It wasn't about how are you doing during the pandemic, because they can't focus on 500 students and ask them how are they doing during the pandemic. It's like, it kind of rushes over your head at this time. We're trying to get back into normalcy. So, I don't know. We don't really have a connection with the counselors so far. And we haven't even had that conversation at all to focus on the students' mental health, because Bodine is one of the top schools in the district. So it's like, they focus on the people that have more problems than they feel are thriving already. We're not thriving, we're just surviving.
You have a follow-up, Reagan? Thank you, wow. That tells us a lot. Thank you so much for answering that question. So at this point, if anybody has any question they would like to ask folks about anything they said, or as your experience as it relates to this, not your speech on your experience, but questions for people who are up here, we're really eager to hear from you if you have any questions. Yeah, Saki.
Good morning, Pam, and thank you so much for sharing, especially shining rock stars. My name is Dr. Kimberly, I'm the Chief Executive Officer at Wonder Spring Early Education. My question, because I heard so much about collaboration at this panel, what are the plans and process, and especially what Dr. Stanford said, to break down those walls and allow more partners to come in, especially in the early childhood community, where a lot of early childhood providers, quite frankly, Dr. Watlington, feel very shut out and left in the dark, still our teachers, like all kinds of stuff. When we talk about no child care, because our teachers left and went to work for the district, more power to them. My point is, how can we, what are the plans to break down those barriers and allow more partners to come in and collaborate to support the work?
Thank you for the question. Donna Cooper talked about the listening and learning session. Well over about, I'm at approximately like 50 now, approaching 50. Out of 80, we'll try to get to 100 if we can, but we'll certainly do no less than 80. We're going to treat this feedback today just like any other listening and learning session. And I've heard the feedback very clearly from you and Dr. Stanford and others that we need to take a hard look at who we're coordinating with in terms of contractual services to ensure it's not just the same people all the time that have a different tent, if you will. We're coding all of these themes over the next 30 to 45 days, and we're going to summarize all these by listening and learning in terms of some findings and recommendations. Okay. And I would not be surprised if this were one of those that we'll take a hard look at. So thank you.
I'll be there.
Lee Quinn.
I want to have when we talk about coordination a lot, we are one of the little single in a little neighborhood where we want to be the anchor of the neighborhood. So the coordination is critical. So I can't stress that. But my question to you is, what are you going to do in terms of the system that you already have in place? For example, Office of Children and Family Services has the OCF system. And then looking at what you have been responding during COVID and making exceptions during COVID to make it work for the access center. I'm going to name these things out because I really want you to go back and take a look at those times when you did it because of COVID and take all of that together and figure out how coordination needs to work. It's easy to say coordinate, but how are you going to coordinate it? Even within the school district system, I see my friend here nodding, within the district system. Let's just give an example of after-school program. There are 3 offices that coordinate that after-school program. So how do you look at that and assess what works? What is best practice? How are you going to consolidate all the resources and also give resource to the social undergrad, which is a nonprofit, the CBO undergrad, to partner with you? I'm tapping to what Dr. Stanford said, because I'm so happy to hear that you don't need at this point professional MSW to solve the problem, because we're the one who the children are crying on. We're the one that the family of 5 are mental harm is taking care of the children. And then the 8th grader is taking care of the 5 siblings. So we don't have to, our staff don't have to agree, but what I'm saying is that looking at clinicians, I'm challenging you and asking you not to you, teach office alone to talk about coordination, but coming together and then coordinate that.
Yeah, and I would thank you for that question. And again, just remind you, this is one of the reasons why the Office of Children and Families was created. If you think about it, we are 2 years in, and we had to help manage a global crisis, right? A pandemic. And so this is now the opportunity. That's why the release of this report is timely, because we are no longer in I would still say that we are in a crisis when you look at the behavioral health and the mental health needs of young people, but we have the opportunity to continue to push the work forward. And so we were able to do that during the crisis. Now is how do you do it and manage it long term as opposed to managing the short term. So what you will begin to also see is additional conversations, including individuals who are doing the work, and so that we can lay out a comprehensive plan to continue the work moving forward.
Yeah, one of the things I heard from, before Dr. Stanford answers, from both Zakia and Lee Quinn is extraordinary generosity, right? People want to help our children and our families, and they have so much experience at the ground level doing that. And I think that the question is, how do the system players tap that experience in a non-bureaucratic way that can really unleash collective potential?
I would add what it would mean for us being school district, city, federal, and nonprofit. Where did you go? Is that when we submit our RFPs and grant applications, that we have to change the eligibility criteria that allows you to be eligible to get the funding. And that's the people sitting here. So there are certificate programs for everything, for business degrees, for diversity, inclusion, there is a certificate at this point for everything. There were, and I hate to bring up a sore point, but there were people who were non-medical giving shots during COVID, okay? So there are certificates, and I'm not saying you should go to that extreme, but that you can say what your experience has been in the field, and that we need to reevaluate and look at that, because it may make you more eligible. And everybody talks about the $2 million, the $10 million grant, but you might need $50,000, and it will go a long way, right? And so those small grants and allocations work, and I think on our side, it has to be so it's more inclusive. The other thing I can tell you from the federal government level is that we have navigators to help you complete that application process. And I'm sure the city does too. And so often you don't know that you can ask for that. And then before you know it, the deadline is passed and you've missed it, right? And so I think I'm putting that out there, that exists. And that there has been money put out for the Biden-Harris administration specifically for training. And I'm talking about mental health workers, that we are including those community folks. Because it's critical. To your point, you are the ones that they trust and are coming to. And maybe with a few extra skills or a certificate, you could do it that much better. With funding, because now you're doing it for free, right?
Yeah, we have one last question. Thank you. Please introduce yourself.
I'm Ashley Toller. I'm the program manager for Behavioral Protective at City. And Dr. Stanford, you mentioned one of the ways you can support the children in the future schools is the digital side. Dr. Watlington, I heard you mention technology is part of education. now in the future. And I'm curious what you both would say are some priorities for us to work on with respect to closing the digital gap. What do you think is important for kids to have and to use?
I'll begin by saying thank you for the question. I think I'll say a couple of things. First, I think it's important that we continue to make sure that all students have access to the internet, no matter where they live. There's this thing about internet desert should be something completely of the past in a country that has the world's largest economy. It is absolutely unacceptable. It should be a human right and a civil right for all kids to have access. Certainly beyond that, I think it's really important to key into something that's slightly different. I paid very close attention to recommendation number, Donna Cooper's group's recommendation number 4, protect children from poverty. Outside of getting kids connected to have access to internet connections, high-speed internet, etc., so they can access these technology resources. Dr. Cooper said something that was really powerful earlier. She said, we know how to get kids out of poverty, and we need to do more of that. I just want to remind us, in 1965, there was one president of the United States in our history that said, I'm going to declare war on poverty. That was Lyndon Johnson. Went to the University of Michigan to announce that football stadium there in 1965. The very next year, in 1966, James Coleman coined this term achievement gap. And we often refer to it more now as an opportunity gap. Long story short, because of an investment of strategic resources, not just throwing away good money after bad, as some people might say, the data crystal clear. The gap between white and black and Latinx students narrowed. The academic gap narrowed from the mid-60s through the mid-1980s. Now, since the mid-1980s, that gap has continued to proliferate. Now, I just thought it was so insightful that, I didn't realize this data until I just saw it yesterday. Over 16,000 fewer children lived in poverty in 2020 than in 2019 as a direct result of the child tax credit. I think as we talk about what schools, what superintendents, what teachers and counselors must do better, we've also got to talk about this investment, a strategic investment to get children out of poverty. Because we absolutely have some models, and I'm very glad that you lifted it up this morning. Thank you.
Thank you for that. I would say specifically about the digital divide, there were a lot of computers that were given out during COVID. I mean, a lot. Meat Mill, Kevin Hart, Comcast, where are those computers? And if you don't know, I would say we get some accountability for where, I know some people sold them. I mean, I'm just being honest, but where are they? So one of the things I would suggest as they come back to school is just as we do a test of the broadcast system, is that you do a test at home, that it's something at night where a Zoom link goes out and you see how many kids have it. The reason why I'm suggesting that is if and when something happens, who doesn't have a working computer, it's possible that some of the kids may have it and it doesn't work anymore, but Comcast would take it back and refurbish it, right? I think it's an opportunity to present to Comcast or whoever the different, I don't know all of them, to ask them now, if you don't already have it, a commitment for the next 3 to 5 years. So they already have it, as I was talking about supplies. This is one of the things we didn't have, right? That can have some of those things stockpiled. They're replacing them all the time. And then when they get a new one, they throw them out, they refurbish them, they send them to developing nations, whereas we need it right here in Philadelphia. So specifically about that, I would definitely, just as the kids are coming back to school and you're checking on all the different things you're checking on, is to see, do you still have the computer? Make sure the kids know they're not going to be in trouble if they lost it or anything like that. But if you have it, we want to make sure. And you set up a night that you do it, and the teachers can report back how many kids have it, how many kids don't, and then you know where your void is, right? So you can fill it. So if something happens, and it may be that school is closed during, this next school year, you'll know that you'll be able to reach 80% of the kids if you plan ahead for it. And also, as I said, getting some foundation funds before the crisis and reaching out and saying, we appreciate so much what you gave. Is it possible that we could fill in the blank?
Thank you so much. Just so everybody knows, building on what Dr. Stanford said, the school district did an extraordinary job distributing computers, and the Comcast funds came through the district's distribution. So the 50,000 computers and the internet hotspots and the connectivity was orchestrated in a coordinated way for once in Philadelphia, right? And we do need to make sure, to your point, that every time a kid starts in school in September, that they have that resource from last year, or they get a new resource if they don't have it. And I'm hoping that happens with the getting back to school. So with that, I'd like to introduce Barbara Gold. Barbara Gold has been a pediatrician at St. Christopher's for years, and I'm just going to close us out, and thank you very much.
Morning. So I represent the history here, okay? Because I actually worked for the school district in the Mark Shed era. For those of you who weren't alive at that time, that was the late 60s, mid to late 60s. So I've done it all. And then I went to medical school, and as Donna said, I've worked at St. Chris, in the St. Chris system for a long time. And before I start my official remarks, I do want to say to Dr. Stanford that one group that you didn't mention in terms of the people active is retired pediatricians. We do counseling. We know how to do it. I've been saying this for a long time, somebody needs to set up a system to get us either to the schools in terms of emergencies, setting up groups, whatever. Okay, now I'm done. So I retired from pediatrics before the COVID epidemic, but nothing that has been said here today wasn't a problem there. It's just gotten worse. But all those problems, not enough mental health, poverty, not enough food, kids not getting the support they need in school. I saw all of that in 35 plus years as a pediatrician in a very diverse practice. And so I've seen firsthand all the things that Donna laid out at the beginning. And they're just more so now. I'm very grateful to the parents and the students who came today, because without their input, we would only be doing not even half the battle. We need to hear from people who are on the front lines, as it were. Should bring all the things that they said, should bring home to us that this is very, very real and much too urgent for any of us to ignore. Dr. Stanford, Dr. Watlington, Commissioner Lee, you have daunting jobs, no question. But I know that I and those in the Children First family will support everything you do that helps our kids to thrive. Not everything you do. My comments to my husband last night, he said, I said, no, the things that help our kids to thrive. So we're with you on the things that work. True to form, we in that family have very ambitious recommendations for what the city, the school district, the state, and the federal government can and must do to ensure that every child doesn't simply recover and rebound from COVID setbacks, but gets challenged and helped to charge ahead. And this goes to a comment that you made, Dr. Watlington, that I was very happy to hear, that there is an opportunity in this new digital age with what the COVID has caused I know from my own personal thing, I can reach out to friends across the country now, even us old folks know how to use Zoom. And, you know, there are good things that are coming out of it. My daughter can come and help take care of her father and work remotely, you know. We need to attach that to the school, we need to grab that and get that working for us in the schools. We know we need to do much better than we're doing and than we have been doing. So start your commitment today, those of you in the room, to help our kids right away by signing the cards on your seats. Don't forget to put your address on it. These cards are going to the Senate. If we're going to ask the Senate to reenact the child tax credit, which we have heard is important, we will get them to Senators Casey and Toomey for you. And I want to just thank you all very much for being here and for caring about this critical issue.
There are extra reports in the back, there's extra copy in the